Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. As reported in the journal Cardiovascular Drug Reviews, as far back as 1998 in India, Guggul was approved as a drug to lower cholesterol and triglycerides in humans based on its proven efficacy and safety profile. Now in Canada and the United States, Guggul is sold over the counter as a supplement or a natural health product where it does not require a prescription from a medical practitioner. Now, as summarized in the journal Cardiovascular Drug Reviews in 2007, overall, most clinical studies show that 70 to 80% of patients with high cholesterol will show a lowering of their blood cholesterol level by 20 to 30% within several months of taking the prescribed dosage of Guggul orally. Now, many patients also see a drop in triglyceride levels, as well as a drop in a key inflammatory marker that's strongly tied to heart attack risk, that is the C-reactive protein that also goes down. In some cases, it also raises the good cholesterol, which is the HDL cholesterol, which takes cholesterol out of the wall of the artery, opening the artery wall up. So Guggul has been shown in human studies to reduce 4 key risk factors for heart and cardiovascular disease. It lowers the total cholesterol and the bad cholesterol, which is the LDL cholesterol. In some cases, it raises the good cholesterol, which is the HDL. It lowers the CRP, which is a very important inflammatory marker for cardiovascular disease. And it lowers, in some patients, triglyceride levels, which is the amount of fat in the bloodstream. So what is Guggul and how does it work? Well, Guggul is the resin from the mucal myrrh tree, which is native to India. It contains sterol compounds called Guggulsterones, which are shown to help excrete cholesterol from the body by converting it into bile acids in the liver and then flushing it through the liver's bile duct into the intestinal tract. As such, more cholesterol leaves the body with each bowel movement in the form of bile acids. And Guggulsterones also have antioxidant and anti-inflammatory effects, which appear to lower the C-reactive protein, the CRP, and it's been used successfully in one North American clinical trial in patients who had knee arthritis. So it has anti-inflammatory effects as well. So this all sounds quite impressive, I think you would agree. So it's quite bewildering that Health Canada does not allow companies that use the proven dosage and standardized grade of Guggul in their supplements to tell the public or state on the label or on their website that Guggul may help to lower cholesterol and triglycerides and or that it has other cardiovascular health benefits. I think it's a case of bad political science taking precedent over good human health science. I'm not against the use of cholesterol-lowering statin drugs like Crestor or Lipitor, or some of the new cholesterol-lowering medications that are now available. That applies very well to people who have high risk for cardiovascular disease and patients who are unresponsive to the use of other cholesterol-lowering measures like diet and the use of Guggul as an example. But to prevent companies who manufacture an evidence-based Guggul supplement from being able to tell the public or health practitioners that Guggul can help to lower cholesterol and triglycerides and provide them with the links to the peer-reviewed research papers that validate its cholesterol and triglyceride lowering effects, like the research I'm providing to you today, I say that doesn't really serve the public interest. I say this because Guggul has been shown to be safe to use in patients with certain liver problems and those who are pre-diabetics and type 2 diabetics, where the use of statin drugs may worsen the liver condition, trigger or worsen type 2 diabetes by increasing blood sugar levels, and also statin drugs can lead to memory loss problems, and also a number of users have really severe muscle pain when they use it. So what's interesting is that Guggul does not have any of these side effects, and it's a good choice to help lower mild to moderate high cholesterol problems in patients who are otherwise at low risk for heart disease or stroke, and it doesn't cause liver damage. So in these cases, Guggul supplementation, along with appropriate dietary and lifestyle change, can be the first treatment choice. If it doesn't work within 3 months or so, a statin drug can be introduced later. But I suspect that the lobbying power of the big drug companies has likely persuaded Health Canada and the US FDA to keep the science and benefits of Guggul hidden from the public and health practitioners who might otherwise recommend it in a select number of cases. Statin drug sales globally were over $15 billion in 2023, and they're expected to reach $19 billion by 2030. I don't think drug companies want to have any competition on the cholesterol lowering front. So I would encourage you to read the 2007 review paper in the journal Cardiovascular Drug Reviews, which I provided in the reference section below. This article reviews all the clinical studies where Guggul has been applied and explains its mechanism of action and its safety profile. In my view, it's a shame that many of the supplements found on the Amazon page, which features many Guggul products, and I provided you a link so you can look at those products, none of those products are allowed to promote their cholesterol or triglyceride lowering effects. And the same is true for Adëeva Forte, which also contains artichoke leaf extract to enhance its efficacy. So I've provided a link to the 2007 Guggul review found in the journal Cardiovascular Drug Reviews in the text below, so you can examine the evidence for yourself. So thanks for watching, and I'll see you next time.